think one of the greatest things is Clemson has always been at the table, sometimes more involved than others, but the last 5 or 6 years, the coalition has really expanded, and Clemson has been a good partner. The one thing about rural areas like this, people will give you a little bit of money, but it's never enough to complete a project. And then we have to go to other, counterparts such as Clemson Extension to try to gain whatever is not in a small grant. And many times grants are not included to continue. They're saying, well, we give you this to get you started, but it's never enough when you have a rural community that has a small amount of business and industry that's at the table helping, and therefore we try to also teach people to try to gain information that they can use to continue to have resources of their own, or, to plant gardens, you can even do some small container gardens, and it'll feed a small family. And especially seniors and stuff, if you have young people assisting them. I believe in intergenerational, and I think, we need to do more of that, to have the young people helping the older people like they used to do in the olden times. The biggest challenge is, all agencies seem to be stressed right now, and they have people here a day or two. We used to have people that would be around, that would be an asset that you could use 5 days a week or at least 4 days a week. And now it's like people are here a couple of days and they're there a couple of days, because we have so much need in the rural area of South Carolina. I think that's been one of the challenges. And even though people are available by phone, some of us are not, in that mode where we can reach out, touch somebody, they get back with you right away. And also in the rural area, you can't really connect many times by phone, because phones we're doing Zoom right now because we couldn't get together personally. But some people are not able to do that. And especially many of the seniors, they're not into this Zoom. The young kids are, but then sometimes they don't have the broadband to connect them. So you still need a personal touch until we get to a different point and we can have community teams. I think that's what we need more of. Our coalition meets once a month. And of course, in between, if we're working on projects, we have a couple of meetings or group meetings with some people. But I think more time together would help, especially the younger people as we get them into working with older people. I've seen, great impact, in my community with partnering with people, getting healthier food to people more timely, the canned foods for the winter when people can't go out. And also people don't have that much transportation. We've partnered with a transportation agency that does run some transportation here. So it's been a great thing, to have people pooling resources together and making sure that the outlying areas have those resources through the faith-based community as well as the coalition partners. I've seen an impact that has been different. The health issues and all of that, we have, a health center that will go into the rural area to make sure people get their vaccinations and all of that. And that's been great. I think Lee County is a prime example of several things that have not been done in other places. Or we have I think we've pressed the limits with the resources we have, but we definitely need more resources here. And we definitely need to continue to work with the youth. The pandemic has really caused a lot of distension, and I would say our children and youth have not gained some of what they needed. And it's going to take us, the coalition and members of Clemson and all of the other agencies that serve, to band together and make sure that we make it happen. Basically say to them, there is more out here than all of us together can do. So through your faith-based organization, your senior organization, your youth clubs that you work with, there's great opportunity and great need. And we will never fill all the need, but as long as we're making a difference and can see that difference, it will make the community better in the future. So there's a lot of availability, and anybody who needs to know how to get involved or want to get involved, they could contact the members of the coalition, members of Clemson, the DSS, the First Steps. You know, we have people from one level to the other. We have the Senior Center, which serves people up to nearly 100 years of age. And we have the Infant Center that starts with the babies when they're in Head Start. And all of those agencies have come together to try to make the difference here in Lee County. And I have seen a difference, but there's more needed. And we need more financial resources because we're really small in numbers of business and industry. And also members of, you know, the food stores. We don't have as many places have, and we don't have the businesses because we are so rural and we're in the middle of the state, but we're also 20 some miles from a lot of things. I really have to first say I do appreciate all of the good things that have happened over the last several years here in Lee County. The teams going after grants, the teams stepping up to the plate when things are short. That's Clemson, as well as, you know, many other organizations here. I think we just need to stick to it more, try to get more, you know, because we're up against all of the big counties that get all of the mega bucks and that have more resources than we do. So we have to make a difference by staying at the table and by trying to leverage everything we can to make the difference. And we owe that to our children and our youth. And we owe it especially to our seniors who spent their lives working and who are older now and can't do as much. So we need to be there because, you know, people live longer when they have people around. And when you build senior complexes and you don't go in and do things with seniors, they're still alone. And the rural health part is very important because they need to eat right, they need to exercise, and whether it's like doing walk tracks or having things that they can feel secure in, it needs to be there for them. And we need to be there to support them when they're out so that we don't have people taking advantage of them.